It's that time again to talk about how this country fails when it comes to poor people. In this edition, we'll look at why dental care in the United States is still a hard needs improvement. Of course, I have Mothra, the bunny of data science, to confirm my findings. And yes, he does have healthy bun teeth as he has returned from the vet with a clean bill of health.
It's just a movie, son. There's nobody that evil in real life.
What prompted this video is a season 4 episode of The Simpsons' Last Exit to Springfield. In short, the amount of medical care available affects the level of dental care Lisa receives. In the 2016 article Tent Revival, quote, "It's easy to imagine that a designer costuming a poor rural southern character in a movie would likely think to begin by styling her teeth, not her clothes." But that kind of judgment is not just fiction. Shame, poverty, and the verb beget are at the rotten root of what brings people to rural area medical clinics. Poverty begets depression and anxiety. Shame begets avoidance. Poor nutrition begets decay. A dearth of doctors and dentists beget poor preventative care. Pain begets self-medication, and it's cyclical. Missing teeth beget unemployment, begets missing teeth, end quote.
Shall we continue to build palace after palace for the rich? Or shall we aspire to a more noble purpose and build decent housing for the poor? How does the Senate vote? Fuck the poor!
In the United States, health insurance is usually split up as medical, dental, and optical. As far as pharmacy or mental health, some companies put both under the medical umbrella, while others separate them out. To make it more confusing, some states create supplemental programs for things such as diabetes, durable medical equipment, and transportation. Dental care in the U.S. has become a luxury. Actually, any health insurance is a luxury at this point. Even in other countries such as the UK or Australia, dental care is not at the level it should be. Despite the fact that the state of your teeth affects overall health and well-being, there are major disparities, especially among those in low-income households or rural areas. In the 2020 PubMed article, Disparities in Access to Oral Health Care, the abstract reads, quote, "In the United States, people are more likely to have poor oral health if they are low income, uninsured, and/or members of racial or ethnic minority, immigrant, or rural populations who have suboptimal access to quality oral health care. As a result, poor oral health services as the national symbol of social inequality. There is increasing recognition among those in public health that oral diseases such as dental caries and periodontal disease and general health conditions such as obesity and diabetes are closely linked by sharing common risk factors, including excess sugar consumption and tobacco use, as well as underlying infection and inflammatory pathways. Hence, efforts to integrate oral health in primary health care incorporate interventions at multiple levels to improve access to and quality of services, and create healthcare teams that provide patient-centered care in both safety net clinics and community settings may narrow the gaps in access to oral health care across their life course." End quote. Multiple sources point out adding fluoride to civic water supplies has been a major positive preventative measure for oral health. However, that doesn't work if you don't have access to usable or drinkable water. I'll link that video here as it goes into details on this aspect, as well as how that creates higher sugar consumption. For this video, I'm focusing more on the lack of access to dental care and how this is just another factor that perpetuates the cycle of poverty. By alleviating the barriers to adequate dental care, we can begin to build a more equitable environment and better future. Originally, oral care did fall under medical and would be done by physicians, but eventually, dentistry was separated out into its own entity. That's extremely oversimplified, but that's part of why dental is separate insurance. Back to the Simpsons episode. It begins with a menacing caricature of a dentist that would terrify any child. Not only that, but the dentist presents an 8-bit computer simulation of what will happen to Lisa's teeth if she doesn't get braces.
Here's Lisa today. Without treatment, here's what she'll look like at age 11, age 14, age 17, and finally, age 18.
Cool! She'll be a freak. But
In the 2014 article linked below, Why Are People Afraid of the Dentist?, roughly 36% of people have a fear of the dentist that for many started in childhood. This fear affects their quality of care as they are more likely to skip or miss an appointment. Later in the article it states, quote, "Those with extreme dental fear had a higher prevalence of decayed teeth," end quote. Of those that had the fear of the dentist from childhood, this was often a reflection of the parents. In the Simpsons episode, Homer and Marge are more concerned with the cost of the braces rather than a fear of the dentist, but Lisa still picks up on this anxiety. I recommend reading the whole article as it gives far more in-depth information on the cause of where the fear comes from. Fear can also originate from the treatment itself, or if they were belittled and shamed by the medical staff. One of the videos I've linked is Service with a Smile, Alaska's solution for America's dental healthcare crisis. The beginning of the video gives a scary picture of what children face when they have the opportunity to see a dentist.
When I was a child, we would be rounded up at the school to see the dentist. When the door would open, we would see the dentist standing there, literally wearing a butcher's apron covered in blood, and our friend holding their mouth. One kid had 8 teeth pulled in one sit-down. That's just what it was like for us when we were little.
According to the video, 87% of America or Alaska natives have tooth decay, and there are 180 villages not connected by roads. So not only is the dental procedure itself jarring, the journey to reach a dentist can be strenuous because it isn't just a simple drive to an office. Other indigenous populations, such as the Aborigine, are less likely to receive adequate dental care in places such as Australia's Northern Territory. Even though the Royal Flying Doctor Service works to reach more remote areas, the Northern Territory is still underserved. At least in Alaska, they are working on ways to resolve issues with dental care, even if the American Dental Association isn't particularly fond of their methods, as they mentioned in the video.
Dentist Jalal Khan sees a range of barriers to good dental health.
For some people, it's just too expensive to access it in the private sector. For other people, it's the tyranny of distance. They're just too far away from the nearest dentist, even if they can afford it. For other people, they might be homebound or difficult to get out of an aged care facility.
Poverty and shame often go hand in hand. If a dental office treats those in poverty as a plague, it adds to that fear and shame, increasing the likelihood they will avoid receiving dental care in the future. Quote, "She means well, but I dread the dental hygienist." The judgmental tone in her voice is probably just exhaustion. The only dentist I can afford to see has an office that's in a perpetual spin of budget-seeking patients. I'm one of scores of people who will sit in her chair today, and whenever I leave, I hear someone standing at the dreaded reception desk trying to argue their way out of a bill in an embarrassed tone, end quote. Not to mention that the shame isn't just for the patients themselves, but also shame in being a parent if they feel they were unable to provide a way for their child to receive adequate dental care. A dentist or other healthcare worker in an office may think they're being helpful by telling the parent to provide better nutrition and have less sugar in their child's diet. But for the parent, it can feel degrading because it's not taking into account what the family may be struggling with. This channel is about finding the real root cause, though, and sure enough, there is a divide between the wealthy and poor when it comes to dental health. The 2017 Guardian article linked below, quote, 14% of people from deprived backgrounds had been hospitalized in need of dental work, against 7% of the better off. It also said that 18% of parents with children eligible for free school meals found it difficult to find a National Health Service dentist in 2013, compared with 11% of parents whose children were not, end quote. But that's the United Kingdom. What about the United States? It's bad, of course it's bad. If it made its way to this channel, it's not because we solved it. Dental care for lower socioeconomic households has been terrible for quite a while, and there are multiple issues at play. One is access. The Minnesota Rural Health Association in the 2021 conference discussing oral health and prevention strategies with patients in non-dental settings, they point out that 1/5 of the population in the United States lives in a rural area. In 2020, the U.S. population was 329.5 million, so 1/5 would be about 66 million people. One way to resolve issues with access is to have more dentists participate in government health programs. Currently, 2/3 of the U.S. is served by dentists in private or solo practice. This means most dental care is paid out of pocket for a large portion of the country. While there are programs for kids such as Children's Health Insurance Program, or CHIP, or Federally Qualified Health Centers, FQHCs, it doesn't mean that access is guaranteed. If a family manages to overcome the hurdle of qualifying for CHIP, the next problem is finding a dentist in reasonable distance willing to do the work. In some counties, there may be only one dentist, if there even is one. This isn't even accounting for other nuance, such as children in foster care, certain disabilities, difficulties in scheduling appointments, obtaining prior approval for certain procedures, or availability of medical equipment. Many dentists don't participate in Medicaid, Medicare, or some insurance programs because of low reimbursement rates and choose to stay in private practice. Basically, if a provider agrees to provide a service within one of these government programs, they're contracted to provide said services at a cost or sometimes even a loss. Submitting claims can be time-consuming and may need to be submitted multiple times before approval and payment. If a dentist decides to participate in these programs, they would need enough non-Medicaid and non-Medicare patients to offset their ability to run their practice or would need to qualify for grants. If we want to change this, it would require speaking with representatives at the state and federal levels to allocate more funds for higher reimbursement amounts. In the Simpsons episode, the pivotal issue for the union is whether or not to keep the dental plan. If they keep the dental plan, Lisa can get braces that don't look medieval and will likely be treated better. In the article Poor Teeth, quote, 126 million people in the US, nearly half the population, had no dental coverage in 2012, according to the US National Association of Dental Plans. Let's say a low-income household is able to find a qualifying dentist willing to perform needed medical services. Are they able to physically get to the appointment? While I touched on this earlier, I want to add that there are still people living in rural areas, such as the Ozarks, Appalachia, Alaska wilderness, New Mexico desert, and Smoky Mountains, that do not have a vehicle and need to request a driving service or have to travel on foot. It's also not uncommon for this type of household to have one vehicle to schedule trips around. I'll link the video for public and private transportation here. I haven't even mentioned the sheer distance and price of gas. When the price of gas increases, this hurts the poor the most. According to the Minnesota Rural Health Association, families will often drive more than 70 miles one way to a dentist or other medical provider. In an older car with roughly 20 miles to the gallon, that's about 7 gallons of gas and anywhere from 3 to 4 hours just driving. In all likelihood, they will have to take the day off work, usually unpaid, on top of paying nearly $50 for gas plus whatever the dentist bill is. A visit to the dentist is costly in terms of money and time. We're not even going to touch on if the vehicle is reliable or not because there's too much to cover already. About 8 years ago, I was working through my first major breakdown due to a low-paying, high-stress job and instability in my personal life. The lack of sleep and stress had affected me so intensely that my gums were starting to discolor, separate from my teeth, and soften. I know that it was stress because I was still regularly brushing and flossing my teeth and my diet was still low in sugar. In the video about sugary beverages, I discussed a coworker that had dentures before she was 30. To fill a cavity would cost a couple $100, but pulling a tooth was only $50. Eventually all of her teeth had been pulled, so she had to get dentures. In multiple sources I've linked to this video, there are people literally having to hodgepodge their teeth together with glue and paper clips.
I've had patients that have had teeth held together with paper clips inside them, and then I've managed to restore the tooth if possible, or remove the tooth if need be.
Even in Shameless, issues with their teeth are rarely mentioned. Alcohol and cigarettes are one of the quickest ways to destroy teeth, yet I can't recall at any point where Lip was having difficulty with his teeth. Statistically, Lip and Fiona should have the worst teeth out of all their siblings. In researching this video, one of my frustrations is how many health organizations and conferences heavily reiterate that dentists need to advise patients to consume less sugar and drink less soda. Most people at this point are aware of this. Many of the slides presented by the Center for Rural Health in connection with the University of North Dakota centered around this preventative measure. So much so, it almost felt insulting by the end. However, North Dakota is number 2 in binge drinking in the United States, with North Dakota State University being a major hotspot. As previously mentioned, drinking does affect the well-being of our teeth, but simply telling people to cut down on drinking is not getting to the root cause of why they are drinking in excessive amounts to begin with. If the majority of heavy alcohol consumption is on college campus, why? Is it because it feels like winter year-round and this is one way students are self-medicating or entertaining themselves? Even if they aren't on campus, is it a way that people are choosing to find an escape from their daily struggles? Researchers need to ask the right questions in order to find the root cause. In the same conference, the speaker also suggested to tell patients to eat healthier, yet did not analyze why the population in this area is worse than other areas of the U.S. They did not address areas of North Dakota, South Dakota, and Minnesota that are food deserts, or that fresh produce is more expensive because of growing seasons and shipping costs. If a patient managed to overcome fear, shame, and transportation to get to the dentist after 5 years of not being able to do so, I was telling them something they likely already know, going to encourage them to maintain better oral health. Why should they return to that same dental provider's office? This isn't to say that patients have absolutely no control over their dental health or aren't aware of the effects in their daily life. In 2022, a large portion of the population in the US understands that smoking, sugar, and excessive alcohol intake will deteriorate teeth and gums at a faster rate. Nutrition is being set up in a different video, but I'll link the budget one here as it affects what groceries we buy and the preventative measures that a household can afford. I can complicate this further by adding in the aspect of how do you address your nutritional needs if you're having issues with dental care. What if your wisdom teeth are growing in and they're impacted, causing migraines, nausea, infection, dizziness? It's difficult to try and maintain a healthy diet if you're unable to access a way to fix that issue quickly when you can barely eat or stand. If the wisdom teeth coming in are pushing the other teeth forward, it creates a jumbled array which may require dental surgery or braces. In a surprise to no one, both cost time and money. As mentioned previously in this video, there are patients that DIY their teeth together, and that also adds cost and time. A patient that used Gorilla Glue to keep a broken tooth together means that the dentist or oral surgeon now has to determine the best course of action if there is infection or inflammation from the homemade solution. Again, personal responsibility is a factor, but it's not the only factor that affects dental health. I was never a heavy smoker, but I quit. I rarely drink alcoholic or sugary beverages. There's rarely, if ever, candy or sweets in my house. While that helps maintain my overall health, I still get cavities that need filled, and if I can't get my teeth cleaned every 6 months, I at least get it done once a year. Even with all these preventative measures, stress still heavily affected my oral health badly enough that when I had been severely stressed, I could wiggle nearly all my teeth because of how soft my gums were. If I was not fortunate enough to have had regular cleanings and cavities filled, I would have dentures by 32, and it wouldn't be due to not eating enough vegetables or drinking Diet Coke.
Won't somebody please think of the children?
There are several programs out there aimed at improving children's dental care, but what about the other end of the age spectrum? Many elderly in the US are on Medicare. Depending on the state, dental insurance under Medicare is better than Medicaid, but it also has its hurdles. Plus, there's the whole VA piece that I tried to figure out, went down a ridiculous rabbit hole, and may end up doing a video just on that. The VA has issues. According to the Census Bureau, 54.1 million Americans are 65 or older. That's nearly a fifth of the population. The elderly surviving on low income are more likely to have issues with oral health. According to the Centers for Disease Control, quote, older adults who are poor, have less than a high school education, or are current cigarette smokers are more than 3 times likely to have lost all their teeth as the comparison groups, end quote. Elder care, nursing homes, and the VA are heavily tied together when it comes to several issues, so that'll be in a separate video, but for now, I want to mention that there are many older residents who are low income and often neglected. Dentures are not cheap and need to be fitted to the patient or it causes further health issues. Add on maintenance, cleaning said dentures, or replacing them if they break, and it gets expensive. Weirdly, trying to find more specific information on dentures is iffy, and about half the sources I found were from companies that made dentures, so I need to research further.
Come on, honey, smile. I bet you've got a beautiful smile. Why don't you share it with the world?
There is no God.
The majority of this video is focused on the health aspects of dental care, but it's ignorant to pretend that we don't judge someone as being poor or unintelligent if their teeth look bad. If a job applicant has discolored, crooked, or missing teeth, their likelihood of being hired is low. There aren't exactly a lot of television shows with characters that have a jumbled smile because too much time passed before their wisdom teeth were removed, or characters that have discolored and dead teeth from constantly drinking Mountain Dew or black coffee. For Lisa, wearing the archaic dental equipment makes her stand out even more than she already does. All this does is make our self-esteem lower, and kids can be absolutely cruel. Even if they are characters with bad teeth, it's usually a result of being an addict or being ignorant. In the 2014 article Poor Teeth, quote, Pennsatucky, a scrappy slip of a woman menacing, beating, and proselytizing to fellow inmates, stole the show during the first season of the Netflix prison series. But amid an ensemble cast of similarly riveting, dangerous characters, it was her gray, jagged teeth that shocked viewers into repulsed fixation. She was the villain among villains, a monster that fans love to hate. Pensatucky teeth became a pejorative in social media, end quote. For Lisa Simpson, she's already othered because she's a nerd. By only being able to afford the bare bones basic healthcare, it sets her apart from her classmates even more. Even if I had needed braces as a kid, my family would have been unable to afford them. For those of us who grew up in poverty, we are acutely aware of the things that set us apart. One student being able to afford the better-looking braces is not going to be teased as badly as a kid with full headgear. We can pretend that looks don't matter or that it builds character, but why are we okay with purposely creating an environment for a young child to be teased more because of circumstances beyond their control? It's unempathetic to ignore that the way we appear does in fact affect us. This does appear to be changing though, as younger generations have more empathy towards those with health issues and have a better understanding of the problems in our health system. It's not just our teeth that we are judged by, but it is one of the most visible. In Poor Teeth, the author points out from her childhood that, quote, "My baby teeth were straight and white and I wasn't obese, an epidemic among poor kids that hadn't yet taken hold in the 1980s, but I had plenty of tells, crooked bangs trimmed at home with sewing shears, a paper grocery sack carrying my supplies on the first day of school while other kids wore unicorn backpacks, a near constant case of ringworm infection, the smell of cigarette smoke on my clothes just as cigarettes were falling out of favor with the middle and upper classes, sometimes ill-fitting clothes, as when the second grade teacher I revered looked at my older cousin's shirt sagging off my shoulder and said, 'Tell your mother to send you to school in clothes that fit you.' In 5th grade, a girl noticed my generic plastic-smelling too pointy boots, a Kmart version of the black leather lace-ups that were in fashion, and for weeks hounded me before and after school, kicking dirt on my shins and calling me Pippi Longstocking," end quote. There are some groups trying to change the issue with access to good dental health care. Remote Area Medical, which is a pop-up clinic that provides dental care for free, also treats patients with dignity and compassion they may not receive in other clinics. In Amy Woolard's article, Tent Revival, she talks about one of the patients, quote, "Sandra has worked at a Tennessee manufacturing plant for 38 years, surviving several layoffs that many of her friends did not, but her company provided health insurance doesn't cover dental care. She previously funneled most of her pay toward caring for her husband, who recently passed away, and who after a cancer diagnosis and heart attack was not disabled enough to receive benefits, but required a lot from Sandra, both financially and emotionally. Since his death," she says, "her grief has brought on a great deal of depression. She's here at the clinic for an extraction and a filling. These are nice people," she says, "and they act like you're somebody," end quote. By the end of the Simpsons episode, the union is able to keep the dental plan, as Lisa is able to qualify for braces that aren't as physically cumbersome. While this is a happy ending for her, there are still many in the US who do not have the same. It's expensive and time-consuming to be poor in the United States, and the fact that we still have these major issues when it comes to dental health is one of the most glaring examples. Empathy in healthcare should not be a luxury provided only to the wealthy. I'll end this video on a quote from Tent Revival that sums it up best. "Access to healthcare is about more than just reducing the travel time between patients and doctors. It's about bringing down those intangible barriers that make a distance seem impossible to cross. The stereotypes that teach that people living in poverty get what they deserve, choose their own poisons, dig their own graves. The employment barriers that leave medical and dental students with a mortgage worth of school debt such that they can't afford to treat folks who can't afford to come to them for care. Rural area medical doesn't solve and won't solve the U.S. healthcare crisis, or poverty for that matter, but it clears a path, one that starts right in our own backyards." Thanks for making it this far. Until next time.
Oh, honey, you can hardly see your new braces. And that's the tooth.
Oops, I left the gas on.